Okay, Amit sir, please continue.
Okay, thank you. So, good morning, all dear participants. In the series of the online lectures of this 21 days National Refresher Course Program, and today we have also a important or the precious resource person for today's lecture on One Health approach in management of emerging zoonosis, Dr. Abhishek Gaurav. So, first of all, on the behalf of all the participant and the organizing secretary of this National Refresher Course Training Program, I welcome Dr. Abhishek Gaurav. First,
Gaurav sir, please continue.
Ma'am, should I continue now?
Yes.
Okay. So if I'm audible, I can start my presentation.
Later on, he completed his masters from the.
Sir, please unmute yourself.
Hello.
Yeah, sir,
Hello?
Amit sir, there is some problem at your end. You have weak internet connection. Gaurav sir, we request you to continue, please.
Okay.
We welcome you on behalf of NADCL and on behalf of all the organizing committee and on behalf of students. Thank you so much for being with us.
So thank you.
Am I audible?
To interact with all the participants. So a very good morning from my side. If I am audible clearly, I would like to start my presentation now.
Yes, sir. Go, so you are audible.
Okay. So today I am going to discuss about the One Health approach in the management of emerging zoonoses. As we all know that today everyone is talking about the One Health approach. So what is this One Health approach? And how can we apply this approach in the management of a very important issue nowadays, that is the emerging zoonoses. As we all know that zoonotic diseases, they are transmitted from animals to human beings and from human beings to animals under natural conditions. So keeping in view the public health significance of this very important topic, emerging zoonoses, and the role of One Health in their management, I would like to discuss about this issue. So first of all, I would like to tell you that I have divided my presentation into 3 parts: what, why, and how. So in the entire presentation, we would like to discuss what is One Health, why it is required, and how we can achieve our goals by following the One Health approach. So first part is what? What is One Health approach? So first, I would like to tell you about the health. As you all know that according to WHO, health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. Now, in this definition of health, we have to be physically fit, and for being physically fit, we require environmental health, because if the climatic extremes are there, we cannot remain physically fit. Similarly, for social interaction and for mental health, we require environmental determinants and also the animal sides. So in this definition of health, we can understand the importance of the other components like the environment and the animal, which are very intricately related with each other. So the animal health, human health, and environmental health, they are related with each other. So they are interdependent. Now coming to one example of One Health. As we know, suppose there is a cattle grazing in the field. Cattle is healthy and it is excreting E. coli in its feces. So the fecal sample is having E. coli, which is contaminating the vegetation, and that vegetation is being eaten by the human beings. So human beings, they are getting diarrhea. So now this is an example that how animal health, human health, and environmental health, they are interrelated. Animal is healthy, but it is shedding out E. coli, which is contaminating the environment, that is the vegetation. And ultimately, that vegetation is causing diarrhea in the human beings. So animal, environment, and human beings, they are related with each other. Therefore, we require something which can address the issues at human-animal environment interface. Now, coming to the definition of One Health, as you all know, according to OHITF in 2008, The One Health is defined as the collaborative, multi-sectoral and transdisciplinary approach working at local, regional, national and global levels with the aim of achieving optimum health outcomes, recognizing the interconnection between the people, animals, plants, and their shared environment. So this is the definition of One Health, in which we are talking about collaborations. Means all the sectors, they must collaborate with each other. Multi-sectoral. Now, what is the meaning of the word sector? Sector means animal husbandry sector. Sector means medical health sector. Sector means wildlife, food safety, vector-borne disease control. These are the different sectors which have to collaborate with each other. And transdisciplinary means multiple disciplines, like we require the help of microbiology, parasitology, environmental hygiene, and many disciplines. They work together with the goal of achieving optimum health outcomes for people, animal, plants, and their shared environment. So coming to the One Health, we can see that human health is dependent on the diet and food security with the environment. Also, the social determinants, the population movements, along with the environmental factors like climate change, water pollution, air pollution, deforestation, biodiversity loss. These are all the issues which are concerned with the environmental hygiene. And animal health, which is dependent on the disease vectors, the intensive livestock farming, the non-judicious use of antimicrobials in the animal husbandry, which is leading to antimicrobial resistance in the humans also. So all these issues, they are very complexly interrelated. The human health and animal health, they are dependent on each other, but at the same time, they both depend on the environment. Now, what is One Health? The key of One Health approach is working together, means collaboration, communication, and coordination among whom the various stakeholders like veterinarians, the human doctor, the food safety workers, the wildlife workers, the epidemiologists, the surveillance workers, ecologists, and also the policymakers. These are the stakeholders which have to work together, which is the key to One Health. Now, I would like to tell you one very interesting story. There were 5 persons who were made blind by tying clothes to their eyes, and they were asked to identify an object. So someone touched the tail of the elephant and said it is a rope. Someone touched the trunk of the elephant and said it's a ball. Someone touched the ears and said it's a pen. So what I want to say is that everyone was identifying the elephant, but no one was able to identify the elephant because no one was identifying the object in its entirety. So no one was looking at the picture from a wide angle. Everyone was looking at a small part of that elephant and recognizing the different parts like different things. So this is a story which is quite related to the One Health. Earlier there was One Health, but as we developed in the course of time, we tried to go for the specialization. Animal health became a separate part, environmental health became a separate part, human medicine became a separate part. In the human medicine, further, we have heart specialist, eye specialist, pulmonologist, orthopedic surgeon, rheumatologist. A lot of doctors are there in the human medicine. The doctor who is looking after the lungs, he has no idea about what is going on in the heart. The person who is looking in the diet portion of the human beings, he has no idea about what's going on in the ears and eyes. So this is what I want to say, that we are all but parts of one stupendous whole. Means earlier we were looking the health as a One Health, but in the due course of time, we tried to specialize in the various fields. And now it has the time, again, the time has come that we have to unite together. Because see, everything is related. In the medical science, you might be knowing that if you go to a doctor, he will just treat your symptoms. If you say that I have a joint pain, he will give you ibuprofen or some medicines to relieve the pain. But that doctor is not looking at why this pain has occurred, what is the cause of this pain. So we have to look at the problem in its entirety, in totality. Then only we can solve the issue. Now, coming to the historical aspect, this One Health is not a new aspect. It is a very old concept which started from the time of Aristotle in 500 BC and also the Hippocrates in 340 BC, who is also known as the harbinger of One Health concept. As we know that Aristotle wrote the book Historia Animalium, in which he described the natural zoonotic history of the animals Similarly, Hippocrates, he wrote a book on airs, waters, and places in which he recognized the environmental factors that can impact the human health. Similarly, Lencisi, he talked the role of environment in the spread of disease, and One Health model, which was the contribution of Rudolf Virchow, who coined the term Zoonoses. Then after that, there was One Health, One World, One Health concept from the Wildlife Conservation Society. Then Roger Maher and Ronald Davis, they joined together and opened up conversation to bring animal and human health together. Then there was OHITF, One Health Initiative Task Force. Later on, there was One Health Commission was constituted in Kansas. And in 2016, it was decided that 3rd November will be celebrated every year as the International One Health Day. So these are some of the developments in the field of One Health. We would like to take one by one. So starting with that, the first contribution was from the Claude Bourglat. He was the person who established the first veterinary college in Lyons. And he recognized that the animal health and its interaction with the human health. So Claude Bourglat, who established the first veterinary college in France, in Lyons, France. Then came Rudolf Virchow. Rudolf Virchow said that between animal and human medicines, there are no dividing lines. Means the medicine which is used for the animals and humans, they are the same. So we cannot divide that this is human medicine, this is veterinary medicine. They are all but the same thing. Also, he coined the term Zoonoses. He was working on Trichinella spiralis, and there he coined the term Zoonoses. Then William Osler, he was a student of Rudolf Virchow. He worked on comparative medicine and comparative biology. And he recognized the integration of human and animal health as he was working both in the veterinary college as well as in the medical college. Then came Calvin Schwabe. Calvin Schwabe, he in his book gave the concept of one medicine. He said that both the sciences, the medical as well as the veterinary sciences, they share a common body of knowledge in the anatomy, in physiology, pathology, and in the origin of disease. They might be different, but the basic concept is same in veterinary as well as in the human science. Then came J.H. Steele. We all know about the J.H. Steele. He is known as the father of veterinary public health. Why? Because he started the veterinary public health unit at CDC in the USA, Center for Disease Control. So he is a great contributor in the field of veterinary public health. And this is all about the history of the One Health concept. Now, after covering the first part, we come to the second part of my presentation. That is why we require One Health. What is the need for One Health? So as you all might be knowing that United Nations has given 17 Sustainable Development Goals to transform this world. Now, out of those 17 Sustainable Development Goals, we can look at the third point, which is good health and well-being. Now, this is the point which is required to obtain the good health for all the living organisms, be it animals, humans, or the plants. So from there, this concept of One Health was given impetus. There it started growing. Then what are the major goals and principles of One Health? As we all know that collaboration between the different disciplines, then combining the tools and knowledge for the prevention of zoonotic diseases. To improve the diagnostic facilities, we must have a good diagnostic facility. As we saw in the case of the COVID, in the COVID testing, there were veterinary institutes like Gadwasu, IVRA, they were involved in the testing of the COVID samples. So this is known as the improving in the diagnostic facility and collaboration between the veterinary and the human sites. Then monitoring and surveillance. Monitoring, you all know what is monitoring. Monitoring is the routine observation about the productivity and various other factors. While surveillance is an intensified monitoring in which we also take actions so as to improve the condition of the disease prevention and control strategies. Then the major goal also focuses on creating awareness among the various stakeholders. So regular trainings and regular conferences and all these things, they are organized so that the stakeholders, they are aware about what's going on in the field of One Health. Then enhanced communication. Communication and information sharing is very important. To manage any disease, we have to be very efficient in communication and information sharing. For example, when COVID started from China, Wuhan, Then if the information might have spread earlier, then we could have easily controlled the COVID pandemic. And one very good example is the Nipah virus. You might be knowing that in 1998, in Malaysia, the Nipah virus led to the mortality in the monkeys. At that time only, we should have taken the action so as to prevent the spread of the disease in the humans, the spillover of the zoonotic pathogen in the humans. So the key to prevention is early detection and early warning signs and prompt action, prompt diagnosis. This is the key to preventing the zoonotic diseases. Apart from that, safe food and water, they are essential. Food safety is now a big issue. As we know that there are around 200 diseases which are occurring because of this contaminated food and water. Then environmental factors, they need to be addressed, because earlier I have discussed that how environment impacts the emergence of the zoonotic diseases, and the antibiotic resistance, which is a burning issue nowadays, that has to be taken into consideration, because AMR can be tackled only through the application of the One Health approach. Because if you think that by prescribing the antibiotics judiciously in the human beings we can control this problem, no. We have to take care about the animal husbandry practices also. Because as you all know that we are using the antibiotics in poultry farming just for the growth promotion, for various other reasons. So judicious use in the animal husbandry along with then prudent use in the medical sciences will help in preventing this menace of antibiotic or antimicrobial resistance. Then to strengthen the emergency preparedness during the disasters, we know that flooding, earthquakes, extreme climates, extreme temperatures can lead to the emergence of the diseases. So these are some of the major goals and principles of the One Health. So what is the role of the veterinarian? Veterinarians have a very important role. We saw in the case of the COVID, there were many veterinarians from my college. They were doing testing in the medical colleges. So we have a good role in the diagnostic, in helping in the diagnostic activities. Apart from that, vaccination of the animals. Vaccination of the dogs for rabies has helped in reducing the incidence of rabies in the human beings. So this is quite interrelated. Then biomedical research, we are all are involved in that. Diagnosis, investigation, and the control of zoonotic diseases, which is a major role of the veterinarians. Then ensuring food safety, because veterinary drugs, we have to use it judiciously. And also there is now a very human cry about the pesticide residues in the foods of animal origin like milk, meat, egg, honey, all these things. Then community education and also the policy decisions. So all these sectors, the veterinarian plays a key role. Now coming to the One Health concept, there are main 4 pillars of the One Health concept, which are emerging zoonoses, AMR, that is antimicrobial resistance, environmental health, and food safety. These are the 4 basic pillars of the One Health concept. Apart from that, there are few other points also which I would like to discuss in detail, like zoonotic disease, vector-borne diseases, AMR, foodborne diseases and food safety, environmental stewardship, disaster response and resilience, and advocacy of the health policies. These are some of the applications of the One Health approach. Now coming to the One Health approach, we know that animal health, plant health, environmental health, and human health, they are interrelated. So we cannot work in isolation. We cannot work in silos. We have to come out and collaborate, communicate, and we have to coordinate our activities. And there are many issues like land use changes and biodiversity loss, which is taking place now. Antimicrobial resistance is a burning issue nowadays. Climate change, as you might have seen that during the May and June, there was heavy rainfall in many parts of the country. So when it is required to be a summer season, there should not be rainfall, because that leads to the propagation of the vector-borne diseases, so vectors, which leads to the emergence of the vector-borne diseases. Then zoonotic diseases, especially the emerging and re-emerging zoonotic diseases, food safety, security, and chemical pollution. Now coming to the zoonotic diseases in India, there are 1,407 diseases, 1,407 diseases, out of which 816 are zoonotic in nature. Means around 58 to 59, or maybe you can call it 60%, they are zoonotic in nature. So out of 1,400 diseases, which includes 538 bacterial, 317 fungal, helmintic, viruses, and protozoal diseases. 816 are the zoonotic diseases. Now, what is emerging zoonosis? I think all of you might be knowing that emerging zoonosis means that zoonotic disease which is caused by a new ecological agent or a previously known agent, but increasing in incidence or the geographical range. That is known as the emerging zoonosis, like COVID-19, SARS, H1N1, swine flu, bird flu, H5N1, Zika virus, Ebola virus, Anta, Nipah. Recently, you might have seen about the monkeypox and also the Chandipura virus. So these are all some of the diseases which are emerging diseases, zoonotic diseases. Now, what about the re-emerging diseases? They are those diseases which have been controlled, but they are breaking the control barriers and again they are emerging. So after the application of the control measures which were controlled, but again they are showing an increase in the incidence of the geographical range. They are known as the re-emerging zoonosis. Now, if we look at the timeline of emergence, we can see that in 1994 there was Hendra virus, then came the Australian bat Lyssa virus, meningeal virus, influenza virus, Nipah, then West Nile virus, FMD, SARS. In the China, it came in 2003, monkeypox, then number of diseases, then Ebola in 2014, and lastly it was SARS-CoV-2. SARS-CoV-2 means COVID-19 because it was started in the December 2019. Therefore, we call it the COVID-19. So it is the latest pandemic which has affected the entire globe. Now, it has to be checked that the increase in incidence is due to the increased reporting or the increased number of cases. This is an important point. Sometimes what happens when we increase the reporting or we increase the diagnostic capacity, then we see number of cases they increase, but that is not a true reporting. True reporting means when the cases they are building up, then we can say that it is an emergency. It is emerging zoonosis. Suppose you have started diagnosing some disease which was not earlier diagnosed, then you will definitely get cases. So that is not considered as an emerging zoonosis. Emerging zoonosis means when the cases they are building up, then it will be considered as the emerging zoonosis. Similarly, this is some chronology of significant zoonotic diseases outbreaks. Like in 430 BC, there was plague, Great White, this in the ancient Greek, which led to 1 lakh fatalities. Then in 541, it was Yersinia pestis, Justinian plague. Likewise, number of diseases like influenza, typhoid, H1N1, H2N2, H3N2, then Ebola virus, SARS, MERS, Middle East Respiratory Syndrome, started in Saudi Arabia in 2012. Then Zika virus in Brazil in 2015, H7N1 in China, Ebola, SARS-CoV-2, and monkeypox recently in 2022. Now, coming for the factors for the emergence, why these diseases they are emerging? First is the ecological changes. Ecosystem changes when they occur, then it leads to the emergence of diseases. For example, extreme climate changes are there, then it will lead to the emergence of vectors and that vector-borne diseases. Technology and industry development. As we all know that today it's a global in the world there is a lot of trade and commerce going on between the countries because of the globalization. So the food produced in one part of the country is transported to another part of the world within 8 hours or 10 hours. So the travel time has been reduced, which has led to the emergence of the diseases. We can see that within 8 hours you can reach from here to America or some other part of the Europe. You are taking the pathogen with yourself, but you are not showing any symptom because incubation period is more than 10 hours. So likewise, travel and trade, they are an important cause for the emergence of the disease. Then microbial adaptation, like we can see in the COVID-19, there are several variants of the RNA virus. Similarly, in the bird flu, we can see antigenic drift and antigenic shift. So these are some of the microbial adaptation and the change which led to the emergence of the newer pathogen. Point mutations, like in the COVID-19, we saw a lot of variants coming up one after the another. Then human behavior, this is very important. As you might be knowing that there are 7 billion species in the world, 7 billion species. But these all species, they are afraid of one species, that is Homo sapiens. Because this Homo sapiens is a very dangerous species. It is causing deforestation, it is causing pollution, it is causing all sorts of anthropogenic activities which are are devastating or which are detrimental to the environmental health. For example, the deforestation in Kaisanu district in the Shimoga of the Karnataka, the deforestation lead to the emergence of the KFD, Kaisanu forest disease. These are some of the examples of the human activities. And breakdown of host defenses like the tuberculosis, the TB is emerging, and the host immune system is not able to fight the TB bacteria. Also, it is a good example of the antimicrobial resistance. The TB earlier was simply TB, now it became MDR TB, multi-drug resistant, HDR, extremely drug resistant. Now it becomes TDR, totally drug resistant. So the drugs, they are not working against the mycobacterium. Then breakdown in the public health or the control measures. Our public health measures, they are breaking down. The control measures, they are not in place. And some of the good examples are the transboundary diseases. Transboundary means coming from different parts of the international borders. Like we can see in the Northeast. Northeast part of our country is sharing border with 5 countries. So there is no solid borders. They are the borders, they are porous. So there is movement of the animals from Malaysia, from China, from Bangladesh, from Nepal to the Indian part. There is no solid border. Porous borders are there. Then the rivers, they are flowing. So they are disposing the dead carcasses in the river, which is taking the infection to the Indian continent. So likewise, there are many issues for the emergence of the zoonotic diseases. Now, the important factor is the population density. As there is migration from the rural areas to the urban areas, so there is, as you know, in the city there is a congestion. There is a people are living in the flats, so the density is increased. So because of which there is rapid emergence of the rapid spread of the diseases. Secondly, the change in the climate and the land use patterns, that is also responsible. Also, the global trade and travel, as I discussed earlier, that we can fly from one part of the country of the world to another part in very short span of time. And last is, animals are more than just food. It means that we are eating everything. The people in the Africa, they are eating raw bats. We are eating bats, we are eating monkeys. So Ebola is coming up, Zika is coming up. Many diseases which are coming from the bats, transmitted from the bats, they are now emerging because we are consuming everything, and that too in the raw form, because not because of the cooking and all these things. Now, from a zoonotic disease to a pandemic potential. See, there is one concept of zoonotic spillover. You might be knowing that there are certain reservoirs, like bat is a reservoir of COVID, or bat is a reservoir of Nipah. Then, if you are eating bat or if you are in contact with the bat, then there will be zoonotic spillover from the bats to the human beings, or from the monkeys to the human beings, or from the civet to the human beings. Now, the transmission will take place between the human beings. Now, there is no requirement of bats. There is no requirement of monkeys. Now, the transmission is going on between the human beings, like in the case of the COVID. It started from bats, but now it is transmitting between the human beings. So amplification from human to human transmission is increasing, and also it is spreading globally. Now we will take few diseases so as to understand this concept. Rabies. As you know that by 2030, we want to eliminate the rabies. But there are many hurdles in the path of One Health approach. Like the priorities are different for the different sectors. The human medicine is working on the human patient. They are not bothered about the sylvatic zoonosis, rabies. Then the population of the stray dog is very large. Then we have limited logistics. The human health and animal health is a state subject, not a central subject. Lack of political will. And these are some of the issues like one important is the misreporting also. Like suppose there is a dog bite. In many instances, we write it as a case of rabies. But that is not a case of rabies. That is simply a dog bite. We can say that it is a case of rabies only after doing the FAT or identifying some negri bodies by the confirmatory diagnosis, I want to say. So then only we can say that it's a case of rabies. Just by the mere symptoms and by the dog bite, we can't say it's a case of the rabies. But it is sometimes misreported because technicians are there, they have no knowledge, they just write it that it is a case of rabies. So it's a misreporting. And the One Health approach in the rabies means by increasing the vaccination in the dog, we can decrease the incidence of rabies in the humans. This is a good example. We are working on the human animal side is leading to the disease prevention in the human side. KFD. I discussed earlier that deforestation, because of the deforestation in the Kashmir district, the cattle went deep into the forest, and there it was attacked by the Haemaphysalis filariae tick. And when it came back, it brought back the infection from the monkeys to the human beings. That was of the KFD, Kashmir forest disease. This is a good example of the human activities. Monkeypox. As we all know that monkeypox is now a emerging disease. It has been seen in many parts of the country. And the central government has made a multidisciplinary team to prevent this disease. This is the importance of One Health. Because here, the experts from NCDC, Ministry of Health, and also from the medical college, they are working together. So it's a multidisciplinary team which is trying to prevent this emergence of the monkeypox. Then bird flu. For the diagnosis of bird flu, the birds they are sent to the NISAR in the Bhopal, which is the High Security Animal Disease Laboratory. Earlier name was that. So in the BSL 3 facilities, they are diagnosing this infection which is caused by the orthomyxovirus, that is the bird flu virus. So what I want to say is that the disease in humans can be prevented only by the proper diagnosis in the birds. When we see that there is a mass mortality or the symptoms are seen in the birds, then only we can take the necessary steps so that we can prevent the epidemic or pandemic of this bird flu in the humans. So proper risk assessment, proper exchange of information between the human and the animal sectors, risk mapping, and pandemic preparedness. These are required things to prevent this outbreak of bird flu. Similarly, for the COVID-19, we have already discussed. Then, emerging and re-emerging zoonotic viral diseases in the South Asia. There are many diseases like MERS, transmitted from the camels. Reservoir is the bats. SARS-CoV, bat are the reservoir, and the civet is the transmitting agent. Similarly, SARS-CoV-2 transmitted from the bats. Bird flu from the waterfowls to the poultry coming to the human beings. Zika virus coming from the monkeys through the Aedes mosquito and coming infecting the human being. Chikungunya through the Aedes mosquito coming from the monkeys. So these are some of the viral zoonotic diseases in the Southeast Asia, and how we can control them by the outbreak prevention, disease prediction, early detection, education, early response, prompt information sharing. We can protect from these viral zoonotic diseases. Now, coming to the another aspect, that is on the environmental change. The climate change has an adverse effect on the human health, like it causes various diseases which are vector-borne, like malaria, dengue, hantavirus, Rift Valley, Lyme disease, chikungunya, West Nile fever. Similarly, it also leads to the extreme heat leads to some heat-related illness and death, and also the cardiovascular failure. So there are many diseases which are occurring because of the change in the climatic conditions. Also, the water quality like cholera, cryptosporidiosis, campylobacter, leptospirosis, algal blooms, these are caused by the water quality impacts. Now, we can see that 78% of the diseases, they are aggravated because of the climate change. We can see that its arrow is somewhat on the wrong place. 78%, that is the blue one, is showing the diseases which are exclusively aggravated, while 19% diseases, they are both aggravated as well as diminished because of the climate change. Only 33% are diminished by that. Then flood, as I discussed about the natural disasters. So if there is severe flood, that led to the emergence of leptospirosis, because we know that leptospira is caused, is mainly transmitted from the rodent urine. So excessive flood, it leads to the emergence of the leptospirosis. This is one example. Another example is the extreme temperature led to the emergence of anthrax, because the frozen spores, they were there was an anthrax outbreak in 2016 in the Siberia because of the high air temperature, which caused the movement of the spores from one place to the another, and the spores they germinated. Then warming, intense warming and intense precipitation led to the emergence of plague as well as the hantavirus. These are some of the vector-borne diseases which are adversely affecting the human health, and also their incidence is increasing because of the climate change. Because the climate is directly impacting the survival of the vectors like West Nile, vector is Culex, dengue, yellow fever, Rift Valley. These are all transmitted by the Aedes mosquito. Then we have other diseases like KFD, transmitted by Haemophilus spinaceae, scrub typhus by a mite, Leptotrombidium deliens, chigger mite we call it, urine typhus by Giroxella cupis, which is the same vector as that of the plague, epidemic typhus by the human louse, that is Pediculus humanus corporis, Rocky Mountain spotted fever by the Dermacenter, Indian tick typhus, Dermacenter variabilis, Queensland tick typhus by Ixodes, Q fever. These are all the vector-borne zoonotic diseases which are adversely increased in the condition of the climatic change. 1 degree increase in the spring temperature result in the increase in Yersinia pestis prevalence by how much? More than 50%. This is some of the examples of the climate change. Now we come to the another aspect of this, the third pillar, that is the AMR, antimicrobial resistance. Whenever a pathogen is able to survive the minimum inhibitory concentration of the drug, that we say that it is antimicrobial resistant organisms. There are many reasons: non-judicious use, extra label use, the use of antibiotic without the prescription of the doctor, multiple dosing, and using antibiotic for growth promotion. They are not following the withdrawal period, and the drugs, they are not being developed at a very fast pace. Also, the drug discovery is not taking place in a very effectively. So very few drugs they are being developed nowadays, but the resistance is developing at a very fast pace. Then lack of hygiene and poor sanitation, poor infection control in the hospital. These are some of the reasons for the antibiotic resistance. Now, residues. This is an important from the food safety point of view. Whatever food we eat, they have either pesticide residues or antibiotic residues or hormones or aflatoxins or heavy metals. These are all contaminated in very small amounts, which have very adverse health effects, like they cause mutations, they cause cancer, they cause teratogenicity, they cause allergy, they cause toxicity, and they are transferred from the foods of animal origin. These are some of the adverse effects of this. Then how they develop resistance mechanism, I think we need not to go into the mechanism. There are many mechanisms like efflux pumps, enzyme-induced, altered target binding sites, then through the plasmids, transposomes, and mobile genetic elements, also through the decreased cell wall uptake. AMR also comes to the food of animal origin, as I just discussed now, that if you are consuming the milk, meat, or egg which is contaminated by resistant pathogen, then we will consume it. It will make the commensal organism inside our body resistant to the antibiotics. It is a transfer of antibiotic resistance, either through conjugation or through mobile genetic elements. So, likewise, the resistance is also transmitted through the foods of animal origin. A concept of One Health and the farm biosecurity, I will. Now we come to the third part of our presentation, that is how we can achieve the One Health. So this is the WHO, Joint Action Plan of Action. Now, this is the main part of my presentation, that how we can prevent the emergence of zoonotic diseases. So first action is capacity building. Second action is reducing the risk of zoonotic epidemics or pandemics. Third is to prevention and control of vector-borne diseases. Fourth, we have to mitigate the food safety risks. Fifth, we have to prevent the AMR. AMR cannot be eliminated. AMR is a natural phenomenon. We cannot treat AMR. What we can do is we can simply prevent it. We can slow it down. Otherwise, AMR is a natural phenomenon. AMR was there when the antibiotics were not discovered. Before the discovery of the penicillin also, there was AMR. But when we started using the antibiotics non-judiciously, then it started increasing. So AMR cannot be stopped. AMR can only be prevented. Then integrating the environment into the One Health concept. This is the joint action plan which is proposed by the World Health organization. Now, this is very important slide of my presentation, the 4C concept. The 4C means collaboration, coordination, communication, and capacity building. What is collaboration? Collaboration means we are working together. The medical doctor, veterinary doctor, environmentalist, surveillance officer, food safety officer, policy makers, and all the other stakeholders, they are working together hands in hands. That is known as collaboration. Coordination means we are not going one by one. Suppose there is an outbreak in a village, then first medical officer will go, then veterinary. No, we all will go together. That is known as a coordinated movement, coordinated work. That helps in the efficient resource utilization. Because we have limited financial support, we have to use the resources very judiciously. So we have to work in a coordinated manner. Third is communication. Communication between the stakeholders. Suppose there is an outbreak or there is an early warning sign of an emergence of a pandemic or epidemic, then we have to communicate with all the other stakeholders. We must have a list of all the policymakers, veterinarians, medical doctors, so that we can communicate. One very good example I gave you for the communication is the Nipah virus. Because of the lack of communication in 1998 in Malaysia, the Nipah virus is spread to the humans from the monkeys. If we would have communicated earlier when the monkeys were dying, then we could have prevented that epidemic or that zoonotic disease. Last is the capacity building. Capacity building is very important. In the medical side, we see that there are a lot of portals and a lot of high-end diagnostic techniques are there. But in the veterinary side, we are lacking in those diagnostic techniques. So capacity building means we all come to the same level. We all come to the same level. Then only we can share the information. Then only we can communicate. If someone is very high and another one is very low, still struggling, then we can't. For example, in animal side, we have not a very good disease reporting system. But in human side, we have a very good disease reporting system. IHIP, IDSP, these are some of the portals and where we are going for the disease reporting. So likewise, we have to collaborate. Also, the quadripartite partnership is required, like the WHO, WOH, World Health Organization, World Organization for Animal Health, UNEP, United Nations Environment Program, and Food and Agriculture Organization of the United Nations. So these are the organizations which are working in collaboration, in coordination, in communication, and with the aim of capacity building. Then coming to the One Health initiatives, in our country, we have a lot of initiatives being going on, like the National Action Plan for AMR, NAP AMR. It is a subset of GAP AMR. Global Action Plan, it is a small part. Then National Livestock Mission is there. Then FMD control, brucellosis control. Then we have vector-borne disease control program. We have rabies control program, TB control program. We also have leptospirosis control program running in our country. Then we have cohort, that is Center for One Health Education, Advocacy, Research and Training in the Kerala, KVAS, that is the Kerala Veterinary and Animal Science University. Then we have developed the collaboration between the Ministry of Health, Ministry of Agriculture, Ministry of Environment, Ministry of all the concerned ministries. They have collaborated with each other. Then we have one National Institute of One Health in Nagpur, which was established in 2019. We also have Center for One Health in Gadwasu, Ludhiana. Then we have rabies control program. We have control of Zoonoses program, leptospirosis control program, as I have earlier discussed. Now, what to do? What we have to do? First is engagement. Engage all the stakeholders. Identify them. Prioritize the zoonotic diseases, which is of high priority, which is of least priority. This is the first part, that is the engagement. Second is the assessment. Assessment means you must know about your strengths and weaknesses. What I am capable of doing, what I am not capable of doing. So where there is incapability, we have to improve on that part. So that is assessment. We have to conduct a gap analysis. What are the loopholes in my work strategy? So we have to identify the gap and we have to assess our strengths and weaknesses. Third is planning. We have to create a plan. We have to create a SOP, standard operating procedure, that in an event of emergency or in an event of outbreak, what we have to do? We have to make a plan. multi-sectoral collaborations, coordinations, and communication is required in the planning. Then fourth is implementation. We have to implement the plan in the field. We have to go in the field and we have to implement the plans, protocols, and the procedures. And last is the monitoring and evaluation. This can be internal as well as the external. We can go for self-evaluation and we can also evaluate our plan. And if there is some suggestions or some corrections are required, we can revise, refine, and continue implementation as and when required. Now, this is the Global Health Security Agenda, which was given by Malaria Consortium in 2025. Prevent, detect, and respond. We have to respond in emergency situations. We have to respond after we have detected the pathogen. Then we have to prevent the AMR, we have to prevent zoonotic disease. So this is the Global Health Security Agenda, which was given by the Malaria Consortium in 2025. Now, coming point-wise about how to control the disease with the One Health approach. The first part is the early detection of the disease. The earlier we detect the disease, the earlier we can act, and that is the key to success. Early detection, because once the disease spreads in the population, it is very difficult to control it. Just like the COVID, we could have controlled it earlier. So early detection, don't hide anything. Whenever there is an outbreak, report it. Be it medical science, be it veterinary science. So early detection, early reporting, early diagnosis, early warning signs, these are the key to success in case of the One Health approach. For example, this is the last I have written, increased mortality in the crow indicates that the West Nile virus may be emerging. Cases of encephalitis, they are increasing. So this is an early indication, the crow population dying. Sometimes we see that domestic birds are dying. Report it. That can be the emergence of bird flu. So we have to detect the disease earlier and we have to diagnose it earlier and we have to see the early warning signs of the disease. This is an image I captured from Karesh 2012 paper. This is available on the internet. You can just see that in the upper picture, the red one is the human cases. And in the lower picture, we can see that the red hill is smaller in size. This is because of the rapid response. If we are responding rapidly, the disease in the humans that is drastically reduced to a lower level. Similarly, rapid response, early detection also reduce the incidence of disease in the animals. So this is the take-home message that rapid response, early detection, they are required for decreasing the number of cases and decreasing the incidence of the disease, both in animals and as well as in the humans. Now, detection of the emerging zoonotic pathogens, there are three parts. First is the identification at the local community level. You have to be in touch with the community because community persons, they are the first one who notice the emergence of any disease or outbreak. They will tell you. So the community participation is very important. Then we must have sufficient infrastructure. Lastly, we must have a robust diagnostics. We have a state-of-the-art facilities for the diagnosis of the pathogens. This is the normal path. But what are the hindrances? I have written in the bottom and the top side. Reporting. Reporting is very poor. Animal husbandry side, the reporting is quite poor. Infrastructure, we are still lacking in the infrastructure in the field. That has to be improved. Transportation of the samples, that is still a problem. We have to work on it. Communication is, we are lacking in the communication. And last is the training. We have to give training to all the stakeholders so that they are made aware of the recent developments in this One Health area, One Health approach. Now, early warning system and response, we have to collaborate with the research institutes, private clinics and NGOs, international bodies like WHO, WOH, UNEP, and all these FAO, then community and the government. What we have to do, we have to make a multidisciplinary team at the local level. We have to monitor the animal markets, where the animals they are sold off, why the person is selling the animals. Sometimes what happens when there is a disease outbreak, the farmers they sell their animals because they get very less compensation from the government. So they sell their animals which are diseased, and that leads to the further spread of the disease in the entire population. Then what is the animal quarantine system, vector and reservoir management, affordable vaccination, medical and veterinary services in the rural areas, community participation. These are all the things which have to be taken into account for the early warning and response system. Second point is the monitoring and surveillance. The disease outbreak should be promptly reported to the higher authorities. Whenever you find any disease outbreak emerging, then you must report it to the higher authorities for the timely action. And we have also to track the wildlife, because there are many zoonotic diseases which are coming from the wildlife sites, like the sylvatic zoonoses. There are many, rabies is also coming. So to control rabies and other sylvatic zoonoses, we have to track the wildlife. Now, this is the surveillance cycle, very important. First point is diagnose. We have to diagnose the pathogen. Secondly, we have to collect the samples. Third is we have to analyze the samples. Fourth is we have to interpret what are the results. We have to see that from the standard criteria, we have to match it. That is known as the interpretation. And last is dissemination of the knowledge. And we have to take the action. This is the surveillance cycle. This is different from monitoring. Monitoring simply means routine observation. You are recording the milk production, or wool production, or whatever production. So this is about the monitoring. But surveillance means diagnosis, collection, analysis, interpretation, dissemination, and action has to be taken so that the disease can be. Case definition, suspect, probable, and confirmed cases. First of all, we have to go for the suspicion on the basis of the clinical sign. After suspicion, we can go for the probable diagnosis. That is sign along with the epidemiological indications. And confirmation can be done only after the confirmatory diagnosis. For example, in rabies, we can confirm only after the FAT, okay, or this cellular staining, the Negri bodies. Otherwise, we will not say that just on the basis of a bite or some symptoms, we can say that it is a case of rabies. No, we have to go for the confirmatory diagnosis. Now, importance of preventive strategies for the early threat and identification and minimizing the zoonotic spillover. We have to prevent, and we have to be prepared, and we have to respond. So, by how will we respond? By improving the diagnostic facilities, by improving the surveillance, by improving the capacity of the healthcare, vaccination, and management. Similarly, we can prevent the disease by reducing the activities, risk activities, and by addressing the human activities, and by performing the integrated surveillance. Next point is prevention and control measures. We have to improve the isolation facilities, quarantine, vaccination, and biosecurity. Also, we have to control the biological and the mechanical factors. So this is in short about the strategy for the control of zoonotic infection. First is collaboration, then improved surveillance, then strengthening the laboratories, improving case management, vector control, reducing transmission, and then developing preparedness and response capacities for the emerging zoonoses. So this all can be done by effective communication, and communication has to be first, right, and credible. Whatever you are communicating, that must be the first report quickly. Second is it must be right, and third it must be credible, trustworthy. Then public awareness and participation, the creation of the cooperative framework should be done, and information sharing and coordinate response. We have to shift from reactive to proactive integrated multi-sectoral response. Means we have to work before the occurrence of an emergency. We don't have to react. We don't have to act. We have to be proactive. That before any event occurs, we have to be prepared for that. We have to go for integrated multi-sectoral response. Now, what are the different stakeholders for the One Health mission? There are many stakeholders from the climate side, from the animal husbandry, from the human medicine, food safety officers, surveillance officers, epidemiologists, ecologists. These are all the stakeholders, and various organizations, NGOs, private sector, academic institutions, and also the political and persons. They must also be involved in the One Health mission. The next point is the intersectoral collaboration and the coordination. As I discussed, there are various sectors like human health, medical health, environmental health, food safety, vector-borne disease, all the sector must collaborate, must coordinate, so that we can have a rapid response towards disease control and also for efficient utilization of the resources. Then capacity building. Capacity building means all the stakeholders should come to the same level. Suppose I am a veterinarian and I don't have a proper disease reporting system, then how will I collaborate with the medical sites? First of all, we have to raise our standards so that we can have at par with the medical. So that capacity building is very important because all the sectors, be it environment or something, they must come to the same level of understanding. Then only we can collaborate. Otherwise, it is difficult to collaborate. So tackling zoonotic disease outbreak through one health approach, communication, coordination, capacity building, and collaboration. We have already discussed this thing. Collaboration. Vets are not required to study medical science and vice versa. Whenever we are going in an outbreak investigation, I don't have any knowledge about the medical science. But if a medical doctor is coming with me, I can share knowledge with him. Similarly, a medical doctor has no idea about what is going on in the birds, rats, bats, camels. I can share knowledge with him. So this is known as a collaboration. You don't need to study the books of medical science, and medical doctor is not required to study the books of the veterinary science because we are experts. We will tell about the animal side. The medical doctor will tell about the human sides. So we have to collaborate. For example, dengue. In the dengue cases, whenever the cases of the dengue increases, there is a burden on the medical doctor. But the burden should be on the municipality because they have to take care of the potholes where water is accumulating. So this is the One Health approach where you have to take into account the municipality persons also because they are responsible for the accumulation of the water. So this approach has to work with the collaboration and coordination of all these stakeholders, not only one. That if the dengue cases are increasing, the medical doctors have to be on the limelight. It is an important role of the municipality also to take care of the dengue cases. Environmental management, mitigating the climate change. This is a very broad issue. Global warming, climate change, biodiversity loss, environmental pollution, preventing the deforestation, and the waste disposal is another problem. These are some of the important issues which are very much pertinent and have an important role in the disease spread and emergence. But we have to take care of these things. As far as possible, we have to mitigate the climate changes and conserve the biodiversity, in situ and ex situ both. Control the pollution as far as possible. We can go further that now this battery operated vehicles are coming up. We can go for solar energy. So we have to prevent the climate change. Directly, they have no impact on the disease, but indirectly they are causing a lot of the health issues in the humans as well as in the animals. Mental also and physical so high as well because many diseases they are emerging. Environmental management by community engagement, education awareness, mitigation and adaptation, early warning signs and preparedness, and all many things. Food safety. The next is the food safety. The food safety means food standards we have to follow. We have to go for risk assessment, risk management, antibiotic and pesticide residues. We have to control all these things. And we have to prepare food in ways that prevent foodborne illnesses. That is the food safety. Hygienic processing of the food coming from the disease-free animals, no antibiotic and no pesticide residues, and less bacterial load. And last point is the AMR. So AMR we can prevent by the judicious use of the antibiotic, improved animal husbandry practices, regulating the use of antibiotics. Now this is the NAP AMR, which I was discussing earlier. National Action Plan on AMR. This we are following in our country. And this is a subset of GAP AMR, which is Global Action Plan on AMR. From GAP AMR, we have made our own NAP AMR by adding one or two points. What does it mean? We have to put the AMR in the school curricula. Teach school-going students that what is AMR. Training, behavioral change. Then geographical patterns of the AMR we have to decide by the mapping. We have to characterize newly emerging pathogens. Hygiene, sanitation has to be emphasized. Vaccination, diagnostics. And today you can see that there are a number of apps which are selling medicines. Pharmacy app, and I would not like to take the names. Many apps are there. So when the medicines they are being sold without the prescription of a doctor, when you can purchase the medicine from the shop owner, then it's really a problematic issue. No? We have to take the advice from the medical practitioner. Proper prescription should be there. Economic impact assessment has to be done based on the socio-economic burden. And lastly, we have to reduce the risk of future pandemics. We have to increase the productivity. We have to improve the ecological services, biodiversity conservation, pollution control. We have to go for food safety and food quality assessment and management. And lastly, we have to go for the improved climate mitigation and adaptation capacity. With this, I come to the last part of my presentation, that is a way forward. So the DBT has made a One Health consortium in which there are more than 27 organizations are there. From Rajasthan, we have Rajuvas, and I am the co-PI of that project. I am working as the co-principal investigator in this DBT funded project, and my advisor, Dr. Dr. J.S. Bedi sir, he is under his guidance. We are working from the Kadvasu, is the main leading organization which is taking care for that, and also the AIMS Jodhpur is also one of the part of this consortium. So this is an initiative from the Department of Biotechnology, DBT, whose project is running in our institute, and I am looking after that project. So this is one of the initiatives, One Health consortium from the DBT. Then this is another sector connect from the field epidemiology program in the One Health. That is a joint initiative of the National Center for Disease Control and Department of Animal Husbandry and Dairy. So this FETP India 2025 sector connect. Last week only, I was attending this sector connect meeting, which was held at Udaipur only. So under this program, I was made the mentor of one group. In that group, there was one medical doctor, one food safety officer, one veterinary doctor, one surveillance officer, one epidemiologist. There was a multidisciplinary team, and I was looking after that team as a mentor. And I will, we will go for some outbreak analysis, we will attempt to manage the outbreak emergence. So under this sector connect, we are connecting the various sectors, which are the stakeholders in this One Health program. So this is all from my side. These are some of the references from I have made a presentation. Basically, it's a sensitization sort of talk, which I would like to conclude here. So if you have any doubts or any clarification. Amit sir.
Okay, yes, sir. Yeah. Sir, thank you for delivering such a nice lecture, sir. And I think all the participants will be definitely benefited, sir. You have covered all the aspects of the One Health, sir. So thank you once again for being us and giving the precious time to all the participants, sir.
Thank you very much, sir. It was nice meeting to you, talking to you. बहुत टाइम बाद हम लोग मिल रहे हैं सर,
yes,
ऑनलाइन मोड से। बहुत अच्छा लगा आपसे मिलके। और डॉक्टर अरुण सर से मुलाकात नहीं हो पाई, वो आज कैसे? आज डॉक्टर अरुण जीरवाल सर?
Sir, he is on the way, sir.
Okay, no problem.
Yes, sir.
चलिए,
thank you once again, sir.
मेरी आवाज तो आ रही थी ना properly?
Yes, sir, definitely, sir. You delivered such a nice lecture, sir.
Thank you, sir. Thank you very much, sir.
Yes, thank you, sir.
तो मैं लीव करूं सर?
Yes, sir. You can.
Okay. Thank you, sir. Thank you, sir.